Halloween may be scary, Thanksgiving may be for the bird, and Christmas for decking the halls. But what about you? Is now the time to focus on yourself, maybe before the holidays? Cosmetic surgeon Dr. McIntyre Bridges with Bridges to Beauty joins us to talk more about some common procedures that they often perform leading up to the holiday season. Dr. Bridges will be answering your questions for the next half hour, so we really want to encourage you to ask the questions on your mind. If you're online at KTBS.com, just scroll down, click on that orange Healthline 3 box that takes you to this webcast. You can take part in the webcast right there. You can also submit your questions right there at KTBS.com. Or you can just give us a call during the show, 318-219-4569. Again, that's 219-4569. We'll be taking your calls and your questions until 12:30. So, Dr. Bridges, always great to see you.
Yes, it is. I enjoy coming.
Christmas, Halloween, Thanksgiving right around the corner, and I find it really interesting that this is a time that you guys actually see more people coming in for different types of procedures.
Yes. It tends to be more for body contouring.
Okay.
And again, not full body tummy tucks and things, even though we still see those, but like for, women, they'll wear the bras and they'll have that kind of fat that pushes down,
right.
Or even the axillary region, they'll come in to have that taken off. And also the flank region. I think it's because, with the holidays coming up and they're wearing maybe evening dresses and things along the lines, they want to try to get a little bit better curve.
Mm-hmm.
And so those are really two of the major ones, followed by, of course, the breast augmentations, and followed by Botox, facial fills and stuff to make things look fresher.
Let's start off with the one you said that removes skin kind of around the bra area. What kind of goes into that procedure?
Well, most of that can be done with the smart lipo.
Okay.
Okay, because the skin in that region, unless someone has been really, really big and things and have lost some weight and they have some extra redundant skin, usually has a very good portion of elasticity. Because like with any type of liposculpting, the smart lipo, regular lipo, it all depends upon how well that skin's going to snap back.
Okay.
If it's been overblown, then basically it's probably not going to snap back as well. Like in the stomach region, if they have a bunch of stretch marks, I'll tell them you're probably better off having a tummy tuck, because if you liposuction that area, you can turn what looks like a prune into a raisin.
Oh,
okay, in other words, you can get the bulk out. It's just that basically that skin doesn't snap back, and they're usually not quite as happy with that. So this region, basically the lateral chest wall and the upper back and things, the flanks, they usually have good elasticity. And then some people like to remove a little bit of a fat pocket that's right up here called the axillary tail suspense, which are very, very easy to do. But those are the ones that if you're wearing, a strap,
right.
that tends to kind of stick out. Again, it's fairly simple to take care of.
Interesting. How long does a procedure like this take?
Now, for the back portion and the flank regions, it's probably going to take a couple hours.
Okay.
That's from, we do that in the office, and so coming to the office, giving a little medication to kind of make them a little sleepy, and then prepping and draping, making things nice and sterile, and then doing the procedure. It takes about, I always tell people, between 2 and 3 hours.
Okay. Is there anything that folks have to do beforehand to kind of prepare for this type of surgery?
Well, when it comes to any type of surgery, you want to avoid certain things. You want to avoid aspirin or aspirin-containing products and things for at least 10 days, because that will increase the amount of bruising. Leaves, Advils, I tell people they need to stop them about 4 days before, because they can increase the amount of bruising also. And when it comes to any type of liposculpting, the more bruising you have, which isn't that frequent, the longer it takes for the body to clean up.
Really?
Because remember, everything I do or any surgeon does, I've told them, everybody that comes in the office, everything I do as far as your body is concerned, it's a calculated trauma. I ain't just beating up on people for a living as far as your body's concerned.
Right.
We're doing it for some type of function. It's kind of like taking out a gallbladder. You're doing it for a specific reason, but the body certainly doesn't like it,
right.
Because you feel it afterwards. Same thing with this. But the soreness that you get with the liposculpting, especially the smart lipo, because it doesn't tend to be as uncomfortable as regular liposuction. It's more of a bruisey, stingy soreness.
Okay.
Afterwards, you're going to be wearing a compression garment. Okay, compression garment, like I tell people, it does really 3 specific things over a period of time. The first thing it does, since where I've taken out the fat, I've turned that fat into the holiest Swiss cheese you've ever seen. Okay, and that's what you want me to do.
Yeah.
But you need that pressure to kind of, smash those little holes down into little slits so they don't collect fluid or they don't bruise into those areas. The second thing it does, you begin in probably about 3 or 4 days out and things, it acts like an ace wrap. Right. I mean, because, you know, like any other injured tissue, you know, if you're up moving around things, it tends to kind of swell some. Generally, it can't swell up the same amount as I took out, but, you know, if you can keep the swelling down, I think that's a good strategy. The third thing it does, and that's really from about week 4 out to about week 6 to 2 months and stuff, is it helps the healing. What I'm talking about is I get the fat out, but that fat, that bulge, any bulge you have where there's fat, it's really this fiber sponge of a certain shape, okay, made of just fibrous tissue, gristle, whatever we call it, and all the little holes are filled with fat. That's where your shape comes from, okay? I mean, but the shape has always been there all of your life. It's just as we get older, we tend to kind of take on a little bit more fat, and the shape of that fiber sponge actually comes out. You're kind of beating up on that fiber sponge to actually break up the shape also, besides just taking out the fat. And you know, the compression garment is to kind of give it, you know, maintain the shape that I leave behind, but also as it heals, fibrous tissue, because it's a living tissue, wants to change shape, and so it'll kind of buckle up a little bit or something like that. You know, I want a nice smooth result.
Right.
Okay? The body doesn't care what kind of result you get. I mean, it's just going to do what it's designed to do, because all it sees is trauma. It doesn't see a cosmetic surgery procedure. It just sees trauma, and it's going to fix it.
Right.
Okay, so you want to control how it fixes it. It's not a big deal and things. It won't make big old buckles like you see like in the street popping up. But still, it's one of those situations where I think it's better to control it than to worry about it taking on its own shape.
Right. So you said some bruising afterwards, just like your typical bruise. It's going to heal within a week or so.
Yes.
Pain following this actual procedure is, minimum, or?
It's kind of minimum. It's not bad.
Right.
I mean, sure, you have some people that whine and things, but most of them tolerate discomfort very well.
Right.
I mean, it's not a pain. Doing a tummy tuck is a very painful operation because I'm dealing with muscle. Okay.
Okay.
Anytime you move muscle together or tighten muscle or put a breast implant underneath the muscle, that's uncomfortable, because you know what uncomfortable muscle feels like. It's like for a tummy tuck. It's like I went to the gym, I did 40 sit-ups, I wake up the next day and say, I'll never do that again.
Right.
Okay?
Right.
Feels like that. Whereas with taking out the fat underneath the skin, leaving the muscle behind, because you just don't need to do anything with the muscle with any type of liposculpting. It's more of a bruisey, stingy soreness.
Okay.
The skin over the top for about 6 weeks to a couple months might be a little bit what I call woody feeling. In other words, you go to scratch and stuff. It's not quite as sensitive. That all comes back though.
Gotta tell people though that beauty comes at a cost, right?
Yes, yeah, but it's
no pain, no gain.
Aesthetically acceptable discomfort.
There you go. Now, I think when I think of lipo, I usually think of the legs, the stomach area. But you're saying it's different areas. Even the bra area, the upper.
Oh yeah, I mean we've even done those little humps on people's backs.
Oh really?
Oh yeah, any place there's a accumulation of fat, people kind of worn off and things. The liposculpting is very nice because it's just so easy. You just make a little puncture wound, numb things up. The smart lipo, you're just melting the fat away and things. And I use a little bit of regular liposuction with it just to get the oil out.
Okay.
Your body would absorb it, but it takes an awful long time to the body to do that. I mean, just less the body has to clean up if you use a little bit of liposuction at the end to kind of get the excess out.
So there's 3 different types of liposuction?
Yeah, actually, I look at them as different brushes.
Okay.
I mean, you got the regular liposuction, which is a cannula. I mean, it's like
That's
a little.
your generic that you.
It's a little pipe with little holes in it and things. You put it in there, and it's like vacuuming things out. It doesn't allow you to get real close to the surface of the skin. Okay, which if you're going to have the skin drape well, you really want to kind of break up the little fibrous tissue that's in that top centimeter and a half. So I'll use a smart lipo in that region, and I can use it deep also. But the smart lipo, can be done for gross liposculpting things. It's probably better as a fine detail, like if you're painting a wall and things, you get that roller on, but you don't do that on your trim.
Right.
The trim is a little more of a detail thing. The smart lipo is more of a detail thing. And also because the heat that's generated underneath the skin, that induces the skin to get tighter. Regular liposuction doesn't do that. Okay, for some reason, if the science has shown that basically if you warm the dermis of the skin, the leather of the skin up to 44 degrees centigrade, it induces the fibroblasts that are in that skin to make more collagen, because we lose that over time, you know. And as that collagen is formed and things, it always contracts. And so it just makes the surface area smaller, which is a big benefit in a lot of people.
Okay. So around the holidays, of course, as you're mentioning, lipo, you know, for the women who are going to, you know, go to these holiday parties and wear strapless dresses, that's real common. You were mentioning earlier to me that Botox and really just kind of getting rid of some of the wrinkles is real common around the holidays as well.
Yeah, the Botox is going to make people look more relaxed. It's going to take care of fine wrinkles, especially around the eyes, you know, in the forehead region, where, you know, that H type of look between the eyes. The forehead itself and things, when people get little lines across there, I'm not a big believer in doing real heavy on that, because what will happen is, you know, you'll take care of the wrinkles up here, but their eyebrows will come down just a tad. And again, upper eyelids look older when they become more crowded.
Okay.
You know, lower eyelids look older as they become more elongated. And so, you know, just the frontalis, you know, basically is the part of the muscle that brings things up. Okay, the ones that bring it down, which go from here, glabellar region, all the way across to the periorbital region, they have a tendency to bring things down. In other words, you know, I'm doing this and everything comes into my upper eyelid. So you can dampen this down, okay, and you can knock these out completely, and that generally gives people a little lift off to the side and things, which in women, you know, their brows need to go over, then kind of up a little bit and things, whereas men, it's okay for them to go straight across. But those are just little techniques you use in order to get those shapes. But I'm just not a big believer in knocking out completely the lateral portion of this frontalis, which tends to bring things up.
Right.
You can do more here, but again, if they got wrinkles there and things, I'd do the Botox first. If they come back in a couple of weeks and say, yeah, I still see some, because they'll get about a 9% reduction on the wrinkles and stuff, and I think that's a great thing. You can do some fills in there, but doing fills alone isn't effective, because, you know, if you don't knock out the motion of those muscles, you can put all the fill you want in there, it just won't stay very long.
Right.
You know, all the lines we get around on our face are due to muscle action, bending, and the skin becomes more, I always tell people, it becomes more plastic than elastic over time.
Okay.
It's like getting your credit card. You know, if you're going to tear it up and things, you're going to bend it back and forth until you etch a line in it.
Okay.
That's what you're doing with those wrinkles. You know, in younger people who don't have wrinkles and they use Botox, it's preventative, okay? And even in older people that might have a little bit of wrinkles and stuff, you know, if you just knock it out, you can knock out 90%, 100% of them. I mean, it's just incredible. Those people have been out in the sun all their lives, and their skin is really plastic. They can benefit from it, but, you know, it doesn't take them all out, because they're actually etched in there, kind of like that credit card.
What can a person do too much Botox?
I've seen it.
That's what I was thinking, too.
Yeah, I call it the baby doll look.
Right.
In other words, from
they
here,
just want to have that perfect face.
yeah, but it looks
but
a little
it
freaky.
doesn't. Right.
I mean, from here up and things, nothing moves. And they're and you know, it's like those little baby dolls when I was a kid and things. You know, they would have little round heads and stuff. They have little eyelids. You do like that, it opens and closes. That's exactly what they look like.
Right.
And I think people are getting away from that, because it doesn't look very natural. It always kind of freaks me out when I see that and things. So I really don't do that and things. You know, I'd like people to get a 90 to 80% reduction where they still have a little bit of animation, because it looks normal.
Right.
Yeah, that plastic look from here to here, that's just
yeah,
your
face isn't moving when you smile or blink or
and it should.
anything.
It should. It really should. I think they're funny.
How often does a person do Botox?
Now, generally, you know, it's about every 4 months. When if you're consistent with it, you know, it'll go for every 4 months for about 2 or 3 times, and then it starts to extend out to 5 to 6 months, and then it can go even longer than that. What you're doing with the Botox, you're doing 2 things. You know, number one, yeah, you're knocking out the motion, you know, immediately. Well, within the first, you know, 3 to 5 days, it takes that long for it to set up, and that makes it look better. Okay, but also, it's a muscle you're injecting into. Okay, and all muscles, if they're not worked, tend to shrink, which is not a bad thing when it comes to facial expression. Okay, it'll never go away. Facial muscles don't. You know, skeletal muscles in other areas, if you were to Botox them all the time, they'd turn to fibrous tissue. Just facial muscles, for some reason, don't. As they shrink, okay, because part of that little bulge people get, part of that H and things, is the muscle's too bulky. I mean, you get it relaxed and stuff, it looks better, but as it shrinks, it looks even better. And so The reason that it tends to extend out longer, because you're using the same units of Botox each time and things, is just that it gets saturated more, okay? And they become weak and they don't move quite as much. That's why I think they just go out. I mean, like I say, it will go out half a year or more.
Interesting. All right, so so obviously lipo, Botox, something else you do a lot of around this time of the year, cellulase. This is a procedure that only you guys do here in the region.
Yeah, it's new. I mean, we've had it since March and things, and then I think in March, April, May, and then a little bit into June and things like that. You know, we did a reasonable number of things, but I expected, you know, basically it not to really kind of take off like the Smart Lipo did, because people are outside.
Right.
You know, and you know they've got vacations already planned. They'll put up with their cellulite at that time and things, but we're starting to see people booking for that cellulite like nobody's business. I mean,
Really?
it really is becoming very popular. And because it takes care of that little wavy look, okay? And it actually helps tighten up the skin, and those people who have that little bit of loose skin, not a bunch of loose skin, in that anterior thigh region, the distal anterior thigh region. Nothing's 100%, but it certainly is better than anything I've ever seen.
Really? Now, kind of what goes into the cellulase?
Now, cellulase it's similar in terms, in fact, of the Smart Lipo in that they're both lasers.
Okay.
Okay. Now, the Smart Lipo, the laser beam just goes straight forward. Okay, so you're punching holes in a little fat because you're trying to get rid of fat. What you're doing with the cellulase is you're working real superficial, because that's where the problem of cellulite is. It's not the whole layer of fat, it's just that superficial centimeter and a half. And where it's kind of buckled in or pulled in or has a dip or has a little, like a little hail dent, is where there's an excess fibrous tissue in that region just holding that skin down. Okay, it can't move. Fibrous tissue is like a fishing string and stuff. It doesn't really give. Okay, so if you gain a little weight behind it, the area that isn't held down will puff up above it, and that's called fatty herniation. With the cellulase, it has a beam that goes forward, you know, so you can get through the fat and things, but it also has a beam that is sideways. Okay, the value to having a beam that goes in two directions and they're at 90-degree angles is that you can destroy the little fibrous septum that are holding things down. In fact, when you're doing it, you'll see it, you know, catching one of those little fibrous things, and all of a sudden it'll pop up. You know, there isn't a dent there anymore. Okay, and it's like doing this and stuff and having that pop up. Where you have the kind of fullness above and below, you want to turn that beam down. Okay, so it's actually melting the fat that's bulging up. You're trying to bring the valleys up and the hills down to make it smooth. The final thing you do with it, again, another beneficial part, because it'll thicken that skin by about 25%, is you turn that beam towards the bottom of the skin, towards the leather, and you warm it up, you know, to 44 degrees centigrade. I mean, this is a very sophisticated machine because it stops you if it goes over that, so you don't burn anything.
Right.
Okay?
Right.
I mean, a laser is a laser and things, but and you have to be well trained to use a laser. It's just a lot of safety precautions, but a lot of these things are built in, you know, to the machines now versus years ago when they weren't. And this has made it safer and much more predictable. But in tightening that skin things, you know, over the areas that used to have cellulite, it just improves it even more, even more.
You think a lot of women are doing it because it's just, you know, just finishing up swimsuit season and, okay, I'm going to have a couple of months of downtime.
Absolutely.
And I can kind of cover it up for a while.
Yes.
For next swimsuit
season. The downside from the cellulase isn't that much, because we're going real superficial, and you'll have swelling. Okay, there tends to be a little bit more bruising with the cellulase in some people. I think it's because as you near the skin, some of the vessels, little capillaries, even get a little bit bigger. Okay, and even though it's supposed to coagulate them, things, it's certainly not 100%. But I think that basically in 3 weeks, 4 weeks, they see a difference because the swelling's gone away, and it just tends to improve over a 3 to 1 year period of time.
Great. If you have questions for Dr. Bridges, we invite you to give us a call. We'll be here taking your questions for about another 10, 11 minutes or so today. We're, of course, talking about different cosmetic procedures that are really popular, especially around the holidays. The number to call, 219-4569. We're also taking your questions online right there at KTBS.com. Just click on that orange Healthline 3 box. Ian actually has a question for you online and says, I've been interested in lipo-freeze. I've heard that it can be faster. I travel a lot, so I don't have a lot of downtime for recovery. What are your thoughts?
Well, lipo-freeze, I mean, it is a device. I looked into it a couple years ago. For flank regions that are really bulging over, it will improve those. I don't think it improves as much as a regular lipo, because it, you know, in the flank region stuff, you can only get that top inch or so, and what it does is freezes the fat. Fat's more sensitive to cold than the skin over the top and things. Your body has to kind of get rid of the fat, though. I mean, it has to slowly get rid of it in terms of the dead fat. But I don't think you can get the curves. This is the reason I didn't get it and things. I mean, like I say, it's touted for lower abdomen, flanks if you can pull enough up. I think some of the arm stuff. I'm not sure how predictable it is because, you know, when you freeze something, nothing's uniform. I mean, it's not like being artsy craftsy where you're going, and you can shape things better. This is just clamp it on there, freeze it, see what happens.
Really?
You know, downtime for lipo is not that much, especially in smart lipo. I don't know why smart lipo isn't as uncomfortable as regular lipo. To me, it's the same type of trauma. I'm traumatized in the same area, but people they have had regular lipo and then they've had some smart lipo in another area. They compare. There's a big difference.
Smart lipo, they're saying, is
doesn't hurt
quicker
as much.
recovery time.
Yeah, it's a quicker recovery time. It isn't. You know, it doesn't hurt. I mean, it doesn't hurt as much. You know, recovery depends on what you do too.
Right.
Like if I'm doing a tummy tuck on someone, but they work for UPS, they'll be down longer than I want to, only because I don't want them to put stress on areas. I'm not doing anything with liposuction that will change things functionally. You're not doing anything with muscle. You're not doing anything with nerves and things like that. So from a functional standpoint of view, I'm after a certain shape or curve. There's no functional deficits that are associated with that. And so people just go about their business.
Right.
There's not much downtime to it at all.
Kind of talk a little bit more about tummy tucks. What goes into this? You mentioned that that's kind of more of an intense procedure with intense recovery time.
Yeah, tummy tucks it's fairly common, at least in my practice. The goal of a tummy tuck, I mean, most women, the women who are candidates for and things have had kids, okay? And you know, for 9 months, tells them how many kids they've had and things, the body's only job was to make room for the kid, give it some milk. It didn't care what the women went through, whether they got 180 pounds, 200 pounds, you know, feet were swelling, nose, it just didn't care, okay? And what it leaves behind, it doesn't matter either. I mean, it's just going, God, I'm having a great day, and think, yeah, I look a little different, but you know, I'm doing great. That's what it's saying. Most women don't like that. So the goal of a tummy tuck is really kind of threefold. Number one, tighten all those muscles back to where they used to live prior to pregnancy. Because typically the abs spread apart like this, and it's about the length of a credit card with just gristle there. I mean, if you go do sit-ups and stuff, they'll notice a little bulge in the middle. There's no muscle there anymore because it got spread apart. I mean, because everything spread out geometrically. Tighten the midline muscles, I tighten over here, I tighten across like this and stuff. It's like knitting a girdle underneath there, okay? Because I want everything really kind of back to where it used to live and as flat as we can get it. You always have these intra-abdominal intestines that are pushing kind of against you and things, but you know, you can get it reasonably flat. Second thing is most women have extra skin that was created during their pregnancy program. 99% of the people that I do thinks everything below the belly button is going to go as far as the extra skin. And then you take that skin that's above the belly button, bring it all the way down here, and bring the original belly button back up through that carpet you just brought down. Okay. I liposuction with my tummy tucks. A lot of plastic surgeons don't. There's not a reason not to. I just want the best curves. If you're going to do it, you might as well just try to do it just that one time and things, and just be done with it.
Right.
So I think I get the best curves if I do it that way.
And tummy tuck's something that you should do after you've finished having kids?
Yes, I mean I always say that because your body will make room for that child if you get pregnant after a tummy tuck.
Right.
Okay. Now I've been surprised. I've had like at least 4 people in 23 years who, something snuck up on them, and they've had kids, and I was surprised how well it snapped back. But you certainly can't guarantee something like that.
Right.
I mean, I was kind of impressed. But I'll always say, are you through having kids? Oh yeah, we're through having kids. That'll work out the best.
Right. I invite you, if you have questions for Dr. Bridges, give us a call, 318-219-4569. We're also taking your questions online right there at KTBS.com. We'll be here taking your calls and your questions for another 5 to 6 minutes this afternoon. Let's kind of switch over to men. What are some common procedures among men?
Well, actually, common procedure among men is the liposuction, number one. Okay. And it's primarily abdomen and flank regions. Sometimes chest, although it probably 9 times out of 10 it requires an actual incision and liposuction around it, because if they have large breasts or bigger than they want it to be, most of the tissue on a man's chest, if it's like that, has lots of actual breast tissue in it. Okay. All men have breast tissue. It's just that some reason or another thinks that it's fuller than they like it to be.
Right.
If you try to liposuction, even if you try smart lipo, because I've tried to do that thinking that it would bore through that fibrous tissue, it does a reasonable job, but it's just better to make a little incision around the nipple, take out all that breast tissue through a really incision about that long, and then liposuction the edges, which is more fatty tissue than fibrous tissue. That gives them the flattest. Like I say, if you try just liposuction that, you'll take the fat out, but you'll leave that fibrous tissue, and it's a significant amount that's there.
Really?
So they'll have that, and then they'll have some facelifts, eyelids. They do eyelids a lot, and then I have probably half the people that come in for the ears that kind of stick out and things are over the age of 35.
Really?
Mm-hmm.
What do you do to help with the ears?
Well, what happens is when ears develop, it's a collagen structure, okay, and there's certain elements of that collagen structure that either underdevelop or overdevelop. What I mean by that is, down by the eardrum, that little bowl that all this other stuff in Remen is called the conchal bowl.
Okay.
If it grows too much and stuff, then it'll cause this to kind of roll forward, okay. It's usually a combination of that as well as, if you look at your ear and things, the upper portion of your ear, if it's not sticking out and things, it'll have two folds, an upper fold and then a little sharper lower fold. They're called crusses. And in people who have that just top portion that's out like this, you'll notice that it is flat as all get out. In other words, it's almost bowl shaped. There's no folding in it. When you do ears, the incision's behind the ear, okay, you're generally taking out a portion of that conchal bowl that will roll the ear back, okay, but it won't take care of this flare. So you undermine the tissues behind the ear again, and you create a fold in it by putting stitches behind here. And they're permanent stitches, okay, and they'll stay there forever and things. They're real small. You really don't feel them and things, but you have to get that thing to fold, and I'll take a little needle and stuff, and I'll score the anterior portion of this underneath the skin, because you have to break up the memory that's in that cartilage. Okay. Cartilage has a lot of memory, okay, and you got to break it up.
How painful is that?
Well,
it sounds painful.
Ears are uncomfortable.
Right.
I always tell people that head and neck surgery is like more of a nuisance discomfort. I really can't say that about ears. Ears can be really tender.
Right.
So, they tolerate it and they like the results and stuff, but when you're taking off those dressings that first, day or so and things, they're going,
right,
they're kind of squinching and things, and I don't blame them,
Yeah.
And when you're taking out the stitches about a week later, they're still kind of flinching.
Right.
But, it's just now that's probably aesthetically acceptable pain versus discomfort. But they want it because, I don't care how old they are and things, people have always made fun of them and things. They always wear their hair long because
right,
they want
because
to cover
their
it up.
ears stick out. Yeah.
Yes, yeah. And again, it's not, again, it's a cruel world when it comes to those things, but it's a very, very beneficial. Their self-esteem just pops right up and things.
That's great.
It is. Afterwards, they have to kind of protect it for at least 6 weeks. I have them wear a little headband at night, especially, kids under 6 are probably the most problematic. I haven't seen many of them tear it up and things, but I've seen at least 1 or 2 in 23 years because they're just, they're playing on the playground or something. They get a little rough, or, if they put on the football helmets and stuff like that and they pull up and things. Early on, you have to. You're not ultimately dependent upon those sutures,
right,
for things. It's just basically for shaping purposes. We depend upon the healing of our bodies and stuff to really replace the strength of that long term. And adults, it's not a problem. They'll protect it all day long. Okay,
right,
kids, it just just is. But it's just the way kids are. Those are the ones that worry me. But wearing that little headband across there prevents even adults, if they're moving around on a pillow at night, from folding something up, because the sutures, even though they're permanent and they're strong, cartilage is not strong. Cartilage basically is like a piece of soap. You can take a string and actually drive it through
right,
that piece of soap because it's soft. Cartilage is kind of the same way, so it needs to be protected.
Dr. Bridger, we only have about 15-20 seconds or so. If someone wants to get a hold of you, you guys are located right there on Uri Drive here in Shreveport.
Yeah.
What's the phone number there at the office?
Yeah, it's 219 8555.
219-8555. If you give Dr. Bridges a call, tell him you saw him here on Healthline 3. As always, great to see you.
It's great to be here.
That's going to do it for us for Healthline 3. Have a great day, everyone. Bye-bye.